Could the quest for a cancer cure be as destructive as the disease itself? The tragic loss of my best friend Greg to fast-replicating prostate cancer leaves me pondering. Was it the disease, the treatment, or both that ultimately claimed his life? His 5-year post-diagnosis survival could be seen as a triumph, but at what cost? Greg was a national champion water skier, holding on to his records longer than anyone else in his sport. But post-radiation, his oncologist warned him that his pelvis had weakened to such an extent that a fall could prove fatal. The news marked the end of his water skiing career. Chemotherapy wreaked havoc on Greg's body, pushing him to the brink where he often felt that death was a better alternative to the relentless suffering. This is a reality many of you witness daily with your patients. The last time I saw Greg, we were at a major water ski event, a place where he had once clinched a national championship. His spirits were high and we relished our time together. But just 6 short months later, Greg was gone, reduced to a mere shadow of his former self. His final days were a harrowing testament to the brutality of his disease and its treatment. He was bedridden, relying on assistance for the simplest tasks. Hospitalized for IV nutrition, Greg's life had been reduced to a painful existence. This, however, is not a lament about Greg's untimely passing. It's an exploration of the state of cancer care today and the larger medical community. Illness and death are a part of life, and medical advances have undoubtedly eased suffering and saved countless lives. Since the war on cancer started, death rates have decreased by 1/3, a significant victory. Yet, cancer rates are on the rise and younger people are falling prey to the disease more than ever before. Despite the heart-rending agony of treatment, progress is what we hope for. We've come a long way from using leeches to draw out bad blood. Unfortunately for the cancer patient, that is not the whole story. Greg's story is typical of the standard of care protocol for cancer treatment. Doctors cannot deviate from that protocol or run the risk of having their medical license revoked, and they cannot risk what they have worked so hard for. I took another route. I was diagnosed with head and neck cancer. I kept telling Greg he had to hang on for 5 more years and they would probably have something to help him. Unfortunately, I was wrong. It took a couple of more years after his death. My oncologist wanted to start me on 5 days a week for 7 weeks of radiation therapy, and get me started on some mild chemo. He said I would have minimal side effects but would probably have a dry mouth and have to carry a water bottle with me all the time. Plus I would probably have trouble swallowing. He didn't even mention the effect of radiation on the lymph nodes in my neck. Knowing what Greg went through from radiation scared me. My spine is next to my throat. If my throat was going to be affected, it seemed likely my spine would also be affected. I had just gotten addicted to pickleball and could picture snapping my head around chasing a ball. That was a scary thought. The radiation may not have affected my spine, but the possibility was real to me. Fortunately for me, about 2 years after Greg's passing, a friend started a company, worldhealthsource.com. Thankfully, he asked me to join the company. A friend of his spent 5 years in the wilds of China searching for natural, traditional health practices. This is not the story of some mystical herbal remedy used by natives for centuries, but more on that later. What he came back with was Artemisinin. Most people, doctors included, have never heard of Artemisinin. It is a primary drug, according to the World Health Organization, to combat malaria. The Chinese researcher Tu Youyou won a Nobel Prize for her work on Artemisinin for combating malaria. As an interesting side note, the founder of World Health Source, Mike, was a combat Marine fighting in the jungles of Vietnam. Most of the Marines got malaria, but the Viet Cong seemingly never did. They discovered the Viet Cong carried little bags of chopped leaves they made tea with. Much later, Mike discovered those chopped up leaves were sweet wormwood, the basis of Artemisinin. Many scientific studies have been done proving the efficacy and safety of Artemisinin for malaria. Recently, studies show that Artemisinin has great benefits for cancer. Here are 4 examples published in the National Institutes of Health. 1. Improvement of quality of life and survival of cancer patients will be greatly enhanced by the development of highly effective drugs to selectively kill malignant cells. Artemisinin and its analogs are naturally occurring antimalarials which have shown potent anti-cancer activity. NIH. Number 2. Naturally occurring anti-cancer compounds, shining from Chinese herbal medicine. NIH. Number 3. Anti-cancer activity of Artemisinin and its derivatives. NIH. Number 4. Artemisinin and its derivatives as a repurposing anti-cancer agent. What else do we need to do? NIH. When my oncologist came back with a diagnosis of head and neck cancer, I almost smiled. Just looking at my neck, it was obvious something was wrong and most likely cancer. So the oncologist wasn't telling me something I didn't already think. But my first thought was, great, now I can have a real personal testimonial of how well Artemisinin works for cancer. So I refused the many suggestions to get started right away with radiation and chemo. I started on Artemisinin, and after about a couple months, the big bulge on my neck was almost gone. My pickleball friends were concerned for me. One, an oncology nurse, said she was proud of me for making the quality of life choice and forgoing the debilitating treatment she saw every day with her patients. I did let the oncologist talk me into trying immune therapy. I qualified for a trial, did 5 infusions, and then quit. I didn't feel as if it did anything, but it may have helped. But it sapped my energy so much, it greatly affected my ability to feed my addiction to pickleball. So I quit immune therapy and continued to improve. 3 years later, there is still a little residual lump in my neck. It doesn't affect me in any way. I am still taking a preventive level of Artemisinin. None of my scans have ever shown any trace of cancer anywhere other than my neck. So in my mind, I am cured. I didn't have to live through any side effects of treatment, just the pain of the cancer itself, which was not fun, but only lasted a couple of months. And I have no lifelong side effects, like the oncologist described. So to get back to the point of this video, the state of the art on the war on cancer. 2 cancer patients, 2 medical protocols, 2 different results, 1 agonizing pain and death, the other continues a high quality of life, standard of care medical treatment, pain and death, prohibited protocol, quality of life. There's something wrong with that picture. I brought my first oncologist a study showing the benefits of high-dose vitamin C for cancer. He quickly brushed it off. That was when I was doing the immune therapy infusions, so it would seem to me easy to just add to the infusion mix. He just said we couldn't do it. My last oncologist was appreciative of what I was doing and said that doctors should be more open to alternative treatments. But she still suggested radiation even though she could see the results of my shrinking tumor. So what's the answer? Medical science is a great thing, but there are also answers outside of big medical. Allow doctors more leeway in using alternative solutions, at least those based on scientific evidence. Get the medical community and insurance companies more involved in alternative treatment options. However, there is much scientific evidence based on studies. Plus it has years of use with malaria to prove its safety. So with something with a proven safety record and scientific evidence that says it works, the public is denied access through medical sources. It would seem to me that doctors would be seen even more as heroes by their patients if treatment was less invasive and free of side effects. As an additional note, my total cost for Artemisinin was less than the cost of the copay of 1 chemo treatment. That means everybody wins, except for Big Pharma and the hospitals. Our customers have had great success with many different cancers. A few, after success with Artemisinin, stopped taking it and later the cancer came back. They listened to their doctor this time and used standard of care treatment with bad results and sometimes death. Doctors receive enormous trust from their patients. They have worked hard to build that trust. But the doctor's hands are tied. Even if they know and believe in a non-standard of care treatment, they will not acknowledge it to their patient. They cannot risk their license. You can't blame them. We even had a little girl at the end stages of cancer. She was bedridden, confined to her hospital bed. The pain was so bad she couldn't find a smile and was waiting to die. We helped her with our products and eased her pain. She was able to get out of bed and tour the floors of the hospital. And she even found her smile again. She was so far along that she didn't make it. But the horror of her last few weeks of life changed to bring her a bit of quality of life. In her final stages of cancer, a little girl found comfort and a reason to smile again. Share this gift of hope with others battling cancer.